Advocates of Medicaid expansion in Alabama said adding low-income adults to the program could create 28,500 jobs in the state, according to a study from the Commonwealth Fund, a healthcare policy foundation. The announcement follows months of effort by advocacy groups to persuade Governor Kay Ivey to expand the safety net program, even after legislators failed to act during the session that ended last month. The Cover Alabama Coalition represents several organizations that support the expansion of Medicaid. Alabama is one of 12 states where neither voters nor state leaders have opted to increase coverage to all low-income individuals. Alabama has the country's second lowest eligibility limits for Medicaid. The program covers most low-income children, seniors, pregnant women and people with disabilities. However, adults without children and caretakers who earn more than $4,000 a year do not qualify for the program. Expansion would provide coverage to all single adults earning less than $17,774 or $30,305 for a family of 3, about 340,000 people in Alabama. Earlier this year, Cover Alabama published the results of a poll that showed a majority of Alabamians support Medicaid expansion. Federal leaders also offered extra funding that would cover 95% of the costs to states that hadn't yet expanded, a total of $732 million over 2 years for Alabama. Despite the popularity and the extra incentives, expansion has not found much support among Republicans in the State House. The legislature met for the last time on May 17 without taking up the issue of Medicaid expansion. On May 20, supporters of Medicaid expansion began making calls to Governor Kay Ivey, seeking her support. Ivey can approve Medicaid expansion, but the legislature must budget the portion not covered by federal funding. There is no doubt that if Governor Ivey strongly backed an initiative, it would carry weight, said Ivey's spokeswoman, Gina Miola. However, the legislature has to agree to buy in to fully fund the expansion. The Alabama Hospital Association and Medical Association of the State of Alabama have both come out in support of expansion. The Hospital Association has said rural hospitals would benefit from expansion since many treat large numbers of uninsured patients and operate at a loss. In April, 300 medical professionals signed a letter supporting expansion. Republican leaders have continued to express doubts about the long-term costs of a larger Medicaid program. Even Alabama's relatively stingy Medicaid program accounts for about a quarter of the state's total expenditures, according to the Kaiser Family Foundation. States cover 10% of Medicaid costs after federal incentives expire. Efforts to raise more revenue through lottery or gambling bills have stalled in recent years. The most recent effort to promote Medicaid expansion relies on findings by the Commonwealth Fund, which estimated potential economic gains in all 14 states that have not yet expanded.